Trying to get pregnant right now or in the near future, you need to watch this video. I am Kaiten, I'm a nurse. This book changed my life. If you're not a big reader and you don't want to read this book, let me summarize one super important part of it that I think everybody should know. Not every egg, when you ovulate, is good. You have perfect hormones, perfect reproductive organs, whatever. Every egg that you get is not going to be perfect. What does that mean in terms of like IVF and IUI? Same way that someone who's trying to get pregnant and like I said has perfect hormones, perfect everything, and they still don't get pregnant for multiple months, for IVF you're harvesting eggs, right? But a lot of them may have chromosomal abnormalities. This has changed since this book came out, but in the book they talk about how a lady had 10 eggs, 10 harvested for IVF, and only 3 of them did not have chromosomal abnormalities. It means that if those other 7 eggs were implanted, her body would probably not have accepted them. They would have been considered failed rounds of IVF. What I wanted to talk about is that with your egg quality, every couple of months, putting in your body, so let's say you change something in your habits from this video, next 2 months from now we'll start reflecting that change, so that's important to know. Being said, these things and more, but we're just going to talk about these, are really going to affect the health of your egg. BPA is a chemical commonly found in plastics. Since this book was written, there's been a lot of crackdown on the usage of BPA. The problem is that lots of companies are now just replacing BPA with very similar chemicals which do the same thing, but they're not technically outlawed. Plastics in general, if you can avoid using them, let's say to store hot food just in your daily life, that would be great. BPA is also really linked to miscarriage too. We're too early or too late to reduce BPA usage. If you use a lot of plastics in your life, that's okay. That's okay. You can recover. If you want me to talk more about like specific things you can do, let me know. Drop a comment below. I don't know if I'm saying this right. But the other thing on that list with dates, this is how it's spelled. Those are actually now recognized formally as a reproductive toxin in Europe. Chemicals have been linked to age-related decline, infertility, endometriosis, and unexplained fertility. Infertility is considered unexplained. Phthalate usage is also correlated with miscarriage rates too. We'll just consider anything with a high scent rich in phthalates. Perfume, laundry detergent, cleaning supplies, add nail polish and plastic to that list too. This helps. I wish you the best of luck on your pregnancy journey, and if you want me to go through and talk about more like supplements or food things that can help you get pregnant, let me know. I'll comment below with any questions that you may have, and let me know if you knew all of this already, because I didn't.